My name is Twyla Braze. I am president and co-founder of Citizens Council for Health Freedom. We are a national, nonprofit, nonpartisan, free market, patient-centered organization. Our mission is simple and to the point. We exist to protect patient and doctor freedom. This includes protecting patient privacy. As I like to say, he who holds the data makes the rules. Before this organization began, I specialized in pediatric nursing. However, when President Clinton decided to take over the healthcare system, I helped to start this organization, and we have been fighting for health freedom for over 2 decades. Today, 70% of doctors are employed by powerful outsiders who use the government electronic medical record for surveillance and control. To expose the dangers patients face, I wrote a book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, which is in its 3rd printing.
My name is Natasha Chuniavsky, and I'm the Legislative and Policy Specialist for CCHF. Alongside Twyla, I work to establish connections with policymakers at the state and federal level to protect patient privacy and promote individual freedom for physicians and patients. Our online state legislative library provides policymakers with draft legislation that they are able to use to protect freedom in the exam room. At CCHF, we track nearly 100 state bills every year, testifying and organizing support for and against various legislative proposals. It was through this monitoring that we initially discovered the secret state storage of newborn DNA and worked to secure a temporary federal law that prohibited federally funded researchers from using newborn DNA without parental consent.
In 2016, we started the Wedge of Health Freedom, an online directory of cash-based practices, including pharmacies. In 2022, we've gone even further. We are now building a new framework for health freedom in America. This framework will be cash-based at every level, including cash-based hospitals. It will also include true insurance, medical indemnity policies that pay the patient, who then uses the money to pay the doctor and the hospitals directly. The patient is the point of the healthcare system. If the healthcare system does not work for the patient, it doesn't work. Our new framework is going to restore patient-centeredness, price transparency, affordability, and medical ethics.
Our legislative work typically differs year to year. However, there are various issues that require regular action, especially in the federal level. One such issue is the National Patient ID, a federal proposal that would effectively eliminate patient privacy. CCHF has consistently and successfully opposed this policy for nearly 2 decades. Additionally, we work on critical and novel health issues. During the COVID-19 pandemic, we created the COVID-19 Quick Reference Guide, which patients say saved their lives. Our Health Freedom Minute is heard nationwide on over 870 radio stations. And our Billboard campaign has discouraged enrollment in Obamacare and encouraged informed choice regarding the COVID-19 vaccine. Our legislative work takes us from the halls of the U.S. Capitol to the Minnesota Capitol and to the ears and minds of state legislators across the nation. Thanks to your financial support for CCHF, we continue to be effective on the federal and state level on policy issues.
We're excited to be on the front lines of the battle between socialized medicine and health freedom. The task before us is huge. This framework is going to take a lot of work, but we are committed to protecting health freedom. I invite you to join us by donating to our cause. Go to cchfreedom.org and click on the donate button. Join us by donating to CCHF.